Since its inception, the symposium has produced a final statement that seeks to summarize the nature of discussions held, the learning shared, and the implications for the different actors who make up our community. I will now read the Vancouver Statement to you. From the 14th to the 18th of November 2016, 2,062 delegates from 101 countries assembled in Vancouver, Canada for the Fourth Global Symposium on Health Systems Research on the theme Resilient and Responsive Health Systems for a Changing World. This year's symposium consisted of 5 days of 53 organized sessions, 248 oral presentations, 74 satellite and skills building sessions, 385 posters and 155 e-posters. Social media played a great part in whipping up the spirit of engagement before and during the symposium. And blogs also played a role in generating energy before the symposium. The most popular of these was a blog from one of the thematic working groups challenging the concept of resilience in health systems. What has been our progress since Cape Town, where we held the last symposium? Since Cape Town, the world has shifted from efforts to achieve the MDGs to the launch of the Sustainable Development Goals, which maintain a focus on universal health coverage, but call more strongly for a systems-oriented approach by embedding health in broader social and environmental perspectives. In support of these goals, there is even greater focus on research to reduce inequalities in relation to marginalized and vulnerable groups. On the policy and implementation front, there's been a transition in the funding landscape from donor funding for interventions towards emphasis on locally generated funds. In this context, the local production of health policy and systems research is also increasingly valued. Since Cape Town, the membership of Health Systems Global has spread even further across the world, with a majority in low and middle-income countries. The Emerging Voices Group has been institutionalized as one of the thematic working groups of Health Systems Global, making 10 in all. The Society also has a new strategic plan from 2016 to 2020, the result of broad-based member consultations. Health Systems Global and the Alliance for Health Policy and Systems Research have been successful in ensuring greater numbers of policymakers in the Vancouver meeting, which I think is really a critical development. Our outreach, particularly to Latin American colleagues, and simultaneous translation has further diversified our participation. While subnational implementers, journalists, and civil society voices were also present, the Society still needs to seek out, engage, and ensure even greater participation of these communities in future symposia. Some key reflections from this symposium. Several themes emerged from the discussion and debate during the symposium. First, it's important to recognize the many meanings of resilience. Health system resilience and responsiveness is anchored in people living and working within their communities. But we need to be cautious also, not to romanticize communities as being resilient, when sometimes what they're doing is coping in extremely difficult situations. Systems need to be resilient precisely so that the burden of such resilience does not fall on the most vulnerable in our societies. Health systems resilience needs to be qualified by an explicit focus on equity and social justice and support the empowerment of the most vulnerable. Second, discussions among participants highlighted the importance of resilient and responsive health systems as one which provide integrated, people-centered services with a focus on primary health care as the front line of routine services and outbreak response. Subnational actors, including communities, are reservoirs of resilience for health systems. Resilient health systems are those which operate from the end user back and not from the organization forward. Nevertheless, governments have the responsibility for steering all actors, public and private, in the interests of the broader community. Third, while some discourse on resilience emphasizes health security, such a perspective can sometimes be counterproductive and should be balanced with the protection of health and health system strengthening. Health security should be an inclusive concern of the entire global community and never a reason to exclude or marginalize. Fourth, the resilience discourse should be positioned within achieving the Sustainable Development Goals and mobilizing collaboration and leadership across sectors. This, together with integration and a move away from vertical approaches, will help achieve the sustainable management of health systems. Symposium delegates repeatedly stressed the importance of people and relationships, flexibility, and the capacity to mobilize new resources. Fifth, the symposium gave occasion to highlight the struggles of indigenous peoples against historic privileges, including in high-income countries. This has received insufficient attention in the symposia to date. Those in high-income countries, and also many of us who are privileged in low- and middle-income countries, have much to learn from the experiences of indigenous and other marginalized populations. What actions do we seek to take henceforth? The symposium identified several areas of action for us all as a community of health systems and policy researchers and advocates. In addressing researchers, flexibility, adaptation, learning, and innovation are features of resilient and responsive health systems, and these must be fostered. To do this, we need more innovative research and more nuanced frameworks and assessment tools to understand the meanings of resilience and responsiveness. There is a need to support the translation of evidence to action across decision-making interfaces much more. Our responses must include embedding our research within policy-making processes and practice and improving the science of implementation. The 2018 symposium in Liverpool should therefore showcase the new research methods tested over the next 2 years, especially applying the concepts of intersectionality and resilience and developing new approaches to measure health systems performance in various settings. In addressing donors and research funders, we would like that donors more frequently embed research and analysis within their support to policies and programs, so as to ensure that quality evidence informs such programs. In a rapidly changing world, some flexibility of budgets is essential to facilitate innovation, responsiveness, and resilience. We urge donors to respond to this. We also ask funders and research funders in particular to invest further in supporting the participation of policymakers, subnational implementers, journalists, and civil society in dialogues with researchers, including in future symposia. In addressing practitioners, policymakers, and communities, the active inclusion of policymakers in the symposium has been invaluable in strengthening insights into the everyday reality of governing health systems. However, there are still voices which need further amplification. Thought should be given to ways of using different technologies and media to widen inclusivity for remote participation in future symposia. To conclude, the Fourth Global Symposium has allowed our community to hold a light to the concept of resilient and responsive health systems, recognizing their importance for achieving universal health coverage and the Sustainable Development Goals, while also acknowledging the potential shortcomings. Resilience adds a useful lens to our existing concepts and approaches, but it does not replace or supersede them. The world is changing, and resilience and responsiveness are needed more now than ever. The accumulated knowledge we have as a community builds on the continuing symposia agenda of improving the science needed to accelerate universal health coverage, to be more inclusive and innovative towards achieving UHC, and to make health systems more people-centered. For the next 2 years, Health Systems Global, as a community of practitioners and researchers, will look to remain at the vanguard of defining the field of health policy and systems, while impacting our broader communities and improving our global society. This statement was the outcome of a rigorous rapporteuring process, and many people worked very hard to ensure that it reflects the sum of our discussions over here. We will shortly post it on our website, and I'd seek your support in disseminating it. Please tweet it, put it in your newsletters, and above all, promote action based upon it.